Well, I'm Anna Baetjer, and I graduated from Wellesley College and came to the Johns Hopkins School of Hygiene as a student in physiology. The physiology department at the Johns Hopkins, am I talking loud enough?
Yeah.
Physiology at the Johns Hopkins School of Hygiene was called physiological hygiene because it really represented what you now call environmental hygiene. We had people in our department who were concerned with ionizing radiation. We had people concerned with gases and vapors and climatology. We had people concerned with exercise, work, and fatigue. And we had a doctor who lectured on occupational diseases. So way back in 1918, when the School of Hygiene was starting, we were really ahead of the game because we had environment and everything that you all are thinking are brand new, and this just brand new was have been in existence ever since the School of Hygiene started. Well, I came from Wellesley and studied physiology at first because the associate director of the School of Hygiene, the man who really organized the program, was a physiologist and a brilliant one, and it was very exciting to study with him. And so then I was doing sort of research and teaching physiology. And then when he retired, the school didn't appoint, this was in the 30s, and the school didn't appoint anybody to take his place. The other people in the department were left, and I was left all alone. Here I was, the youngest one in the department. It didn't cost them much to keep me, so they kept me. And so they put me under a chairman of another department, and he said, I don't know anything about environmental physiology or whatever we called it, still physiological hygiene then. I don't know anything about it. As long as you stay in the budget, it's all right. My budget was $5,000. That paid my salary. It paid the salary of the technician. It paid all the expenses of learning the courses and even painting the floors. So, you see, I didn't really cost them anything. So I stayed on, but at that time, this was in the early 30s. And in 1935, which is one of the things I want all of us want, I'm sure, to tell you about, was the great development of industrial hygiene in state health departments when Social Security money became available. Would you like me to tell about that now or later? Because Warren and Leonard can add a great deal more. Well, there had been very, very few departments, health departments in the country that had any industrial hygiene at all. And suddenly in 1935, Social Security was passed, and there were, since the industries put the money into Social Security, there were people in the health department who felt that some of that money should be returned to industry to develop industrial hygiene. And among them was Jack Bloomfield and Roy Sayers, and you can all add the others. But anyway, they were determined that some of this would help industry. And so they gave money to the states and to the large cities to establish divisions of industrial hygiene which would service the industries within their districts. And I can give you now, if you like, how rapidly this grew, because there were only 4 states, I think, that had anything in it. Maryland had a little bit of a division, but there weren't very many that were much good. So that what happened was that Connecticut, I might say, because Warren was there, did have a Bureau of Occupational Health, which was doing very well. Mississippi, Maryland, and Rhode Island. If you were to pick the industrial states that would be in advance in having industrial hygiene, would you ever pick Mississippi or even Maryland? But at any rate, the money became available, and so with the Social Security Act, and Mr. Bloomfield, Jack Bloomfield, who was an engineer in the federal government, decided that he was put in charge of coordinating the programs in all the states. And Jack went around and stimulated the states to develop industrial hygiene. And of course, there were very, very few people who were trained in industrial hygiene, and there weren't any doctors much available, so the Public Health Service loaned doctors to the states. And then people got trained quickly, like you all are, and like OSHA had to do, train people quickly. So by it was started in 36. It started in 35, and there were only those 4 states. By 1936, there were 17 state health departments who already had established industrial hygiene, with a total budget of $350,000. This represented only $0.014 per gainful worker in the overall picture of the United States. By 1941, there were 32 states and 4 cities. By 53, there were 42 states and 2 territories and 11 cities, which had industrial hygiene units. So you can see that the minute money became available, and this is a lesson to you, the minute money becomes available, suddenly industrial hygiene units spread up, sprung up all over the United States, and in the state governments as well as in the city governments. And as long as the money was available, these continued, and they made tremendous impact on industrial health. At least I think so. You can comment, and you can comment. But I thought it made a tremendous impact on the industrial health movement to have all of these units started in the state health departments. And later on, we'll talk about the programs that they had, because that's interesting. But this is only how they developed. Then at that time, and this, if I may, tell you a little bit about what was recommended when these states were started in the line of training and in the budgets. Now the budgets, shall I do this now? Or later?
Fine.
You want to talk who you are first?
As long as you can keep.
Go ahead.
Let it.
Well, I don't think, you see, I don't think I'm going to get another chance. If
you want to rest anytime.
I'll never stop talking. Okay, the budget and this is the salaries they were suggesting that the state units pay. The physicians were supposed to get a salary of $5,000 to $6,000. The industrial hygienists were to get a salary from $3,000 to $3,600. The chemical engineers were to get $2,400 to $3,000, and the stenographer got $1,200. That was the recommendation for small units, and if it was a big state, large population, industrial population, the physician director got a salary from $5,000 to $7,500. Imagine any physician from that now. Assistant physician $4,500 to $6,000. The industrial hygiene engineer got from $3,600 to $5,000, and then a ventilating engineer got $3,600 to $5,000, and the stenographer got paid. Now, if it was, and it was very, very large, the physician might go up to $7,500, and the industrial hygiene engineer might go up to $6,000. But all of the salaries were in proportion to this. And the education program, which they recommended that people have, if you were to read it, it sounds just exactly like what your brochure of the University of North Carolina and ours say what you ought to have, and I won't read those. At any rate, my job, since I was alone, and since all the states were developing industrial hygiene, it seemed to me that our department, with only me, had better teach industrial hygiene, because most of our students were state health officers in those days, and what they wanted was to be prepared for their jobs. And therefore, I decided that it would be a good idea if we did a lot with industrial hygiene. And so I organized a lot of courses and went sort of running around like a chicken without the head, trying to get all the courses taught, and to keep the physiology course going. And then the war came, and I will leave that till later. I did war work too. And then at the end of the war, what happened to all of these wonderful programs that were going on in the States was that the money was withdrawn. They no longer would support, the federal government would no longer put Social Security money in, and they withdrew their physicians and said, now it's time for the states to take over the support of this. And the states did not, unfortunately, rarely took over the supports of this. And so the state units began to get smaller and less active. But I continue to teach industrial hygiene and continue to do research in physiology, but physiology directed toward occupational health problems. And then they appointed a professor. After 15 years of this, they appointed a professor to be in charge. And then he was there 5 years and died, and so then there was another 5 years when I sort of ran myself, which was the department. And then after that, we then got a full staff of people in the department. They were primarily interested in physiology. And when I say physiology of this type, they were interested in respiratory diseases and the effects of things like cardiorespiratory diseases and the effects of carbon monoxide and ozone and all sorts of things. So they fitted fine into the concept of basic research as a necessary element of any occupational health teaching program. And so then I retired, and because I had to. And then fortunately for me, they asked me to stay on. So that's what I am now. I'm a sort of a hanger-on. I still teach courses. I still give odd lectures every now and then, or every year, in almost all the industrial medical departments. Our department is now completely reorganized, and all of the phases of environment are under one department called Environmental Health Sciences. And we have a division of occupational medicine, which I am, and there's a division of industrial hygiene headed by Mort Korn. There's a division of radiology, there's the division of physiology, the division of toxicology, and we have a new division added in that is concerned with respiratory diseases in the environment. And so I still teach one full course of my own, and then I lecture in most of the other occupational medicine courses.